Pediatrics, we are designing for everything from infants to often 18, 21 years old. In the cases of congenital cardiology, often up into their 40s. And we're also trying to speak to their parents. So it's a real balance between designing things that are engaging and impactful for children of all ages that meet them at their developmental and psychological levels that speak to their emotional state at the time, but also reassure parents and families that they are receiving the world-class patient care that they need. I like to refer to it as a space that is childlike and not childish. And that's a tough balance that we have. It's an exciting opportunity.
So we really want to make sure that the environment becomes part of the healing process so that it allows for staff efficiency, a feeling of safety, feeling for anybody that's in that environment to have some sense of not being overwhelmed by the environment. Having a place that's way too open is sometimes really overwhelming. So kind of providing layers and landmarks that people can kind of see forward to and feel themselves in this place as part of this place.
We have a lot of opportunities to evolve the design of children's hospitals over the next few years. We're seeing a lot more technical and digital innovation in those spaces, and that's something we have to balance with the humanity of each of those spaces. AI is an increasingly important part of the healthcare experience, but it really can't replace that human connection. So we look to things like AI to help with documentation, to provide additional education, to advance our scheduling. All of this allows our clinicians to have more time with the patients and their families, which is our ultimate goal. We don't want to replace that connection, we want to augment it.
I always start by thinking about comfort and trying to make the patient feel as comfortable as possible. So whatever the setting is, no matter how clinical it is, no matter how much equipment there is to it, I try to make it as intimate as possible. And I also try to create situations where there's some sort of control. They can control the lighting, they can control the temperature if they're feeling too hot, if they're feeling too cool.
You have to really understand what needs to be in the room, what needs to be between the patient and the caregiver. How much of that can we accommodate in a sensitive way in order to allow that connectivity from person to person is really the most important aspect of that engagement, and that there's not this distraction of what can sometimes be intimidating elements.
When we're designing for children's health, we think about not only their physical needs, but also their emotional and psychological needs in the space. How do we break down the scale of spaces to include environments that are more easily for them to digest? How do we use color as intuitive wayfinding devices? How do we speak to them on their emotional and psychological level? I'm really excited about the research and development that's been done around neuroinclusive design. It's really important that we create the strongest communication line between the clinicians and the patient families, and making sure there is opportunities for choice, opportunities for autonomy in the space, whether it's finding a hypo or hypersensitive environment that meets their needs to make them feel the most comfortable so that they can engage with those providers in the most meaningful way. Spaces where they can control the amount of noise in the area, can find a little space that's a little bit more quiet, or a space where they can engage at a higher level. Opportunities for options and lighting, the amount of natural light, the feeling of enclosure of the space.
You need to understand that different people regulate in different ways. So allowing them to have different spaces so that they can change that up and regulate themselves, whether it's a view to the outside or a space that they can walk and pace, or a rocking chair can really make a difference with somebody so that they can regulate themselves really makes a big difference.